to our closing for day one. Oh my goodness, I'm been trying to process everything we've talked about and learn and said today. And I hope I can convey the amount of respect that I have for our speakers and everyone in the audience, and just how real the conversations were today. It was truly humbling to hear people lean into the hard things that need to be said, or the uncomfortable, the difficult things that just have to be said out loud. Brad was texting me during this last amazing session that we just had on health equity. And he said to me, every time someone says something that can be perceived as hard or perceived as awkward, we have to elevate it, because that is the only way that these things will come out of the shadows and be corrected and dealt with. And I thought everyone just did amazing today. So thank you so much for that. I would like to, just in the closing few minutes before we have some social activity, ask you who are with us, what comments or what things stood out for you today? Were there any quotes or anything anybody said? I've got a couple written down on my Post-it notes. And so did anybody make a comment or a quote that really resonated with you? I'm opening the chat just so I can read them as they come in. Just 1 second. Oh, and I see we still have one session going. So I better give a few more minutes, Ben, just to let everybody get settled in this one too. So I will share, just as we wait for the, think of Brad quote. I love it. Well, at least one of them was Brad's, Ellis. I will share, just as we're waiting for the rest of the audience to come join us. I thought that Liz Franklin, in the session with Jim Howley, made a summary that put things in a new context for me, and in an area that I thought I knew incredibly well. Liz Franklin said, real world evidence, which is our data, our patient data, is the what, and patient experience is the so what. And I thought that was such a beautiful, eloquent way of understanding the difference between sets of data versus how we are affected and what our experience as humans, as patients is. And Liz, that was just such an eloquently beautiful way to summarize that. I have to give Brian Lee the best use of an unexpected term today. Brian, in that same conversation, said he was ghosted when he tried to get engagement from a different group. And I was reading in the chat, everybody talking about they've only been ghosted in dating life, never in clinical trial life. So I thought Brian did such a wonderful job on that panel. And then I also was really moved by something Lorna said. It speaks very much to what we believe here at GRYT Health. Lorna said, we need your words, in the context of, we can't assume we know without representation, without your voice. We have no way of knowing how this is better. And I think of something that Ben on our team has said, and that is, we're not complete without you. We can't speak for your experience without you speaking to it. And it truly means that to us, that an experience is something sacred. It is something unique. And your voice is the only way that we can know what that is. It is how we know we matter. And I felt like that came through in so many of the conversations today. It was deeply, deeply moving to be a part of that. I think one other thing I wanted to share, it's hard not to get jaded, right? Many of us have had doctor appointments where we didn't feel seen or heard, or we've had experiences where we felt unimportant or dismissed or not believed. And it's hard not to feel or become jaded. And as I was listening to so many of the examples today, one example that gave me hope was something that happened to me personally. Maybe 2 years ago, I went to see a dermatologist because I had some moles on my back that I was concerned about. And as a patient who had radiation treatment, I know that I have a certain percentage of radiation-induced recurrence, cancer coming from my treatment. And that's something that I live with. It is a part of my survivorship. And I went to a dermatologist I had never met with before, and she came in the room and started asking me a few questions, and then asked me a few more questions. And I started talking about GRYT Health and what we do. And she started asking me a few more questions about GRYT Health. And it got to be more than 5 minutes into the conversation. And I stopped and I said, I'm just so shocked that you're, well, that you're talking to me about these things. And she looked at me without missing a beat, this physician, and she said, I care about you, not your skin. And that moment gave me hope that even though we have these experiences and we feel a loss of humanity and a loss of control, like Ben said, there are moments of incredible hope that I didn't know were possible before going through this. And I think everyone today stands for examples of hope and what is possible when we demonstrate the best of our humanity. And so for everyone who spoke today and everyone who made comments today, thank you for elevating humanity, for saying the hard things that need to be said, and for helping others to celebrate others when they share those same things. I want to say a special thank you to our GRYT Health team, who is deserves some real rest and sleep after the event's over, but not for another full day. Jess and Ben do an incredible job managing tremendous things behind the scenes, and always make it go smoothly. Lauren and Dan really create sessions that bring out the humanity in these topics, the true meaning, not just the intellectual, but the real humanity part of it. And Nicole and Christian make sure people know what's happening, spread the word, and we would love for you to help be a part of that. Daz and his son Greg do an incredible job also leading technology and making sure that everything that we do together works well. And Jennifer does a great job capturing the essence of what's said in these conversations. And so I want to thank those individuals, plus all of our team and board members and advisors and everybody who makes all this possible. I would like to thank Bristol Myers Squibb today for everything they've done to make this first day possible. Mariah and your team, and Uma and Neelam, thank you so much for everything you've done to bring this to light, and do it in a way that is so meaningful. And because I can feel my emotions taking over, I'm going to refer to my notes to make sure that I don't miss anything. So we have a few more social activities for everyone today before we wrap. We thought that'd be a good way to kind of unwind and to focus on some other aspects. It's been really intense, and we hope you find these last few sessions really meaningful as well. There's some choices for you in the same drop-down session area, and you can choose from each of those. So they vary in length. So you can do a couple. You can choose one that's longer. Please feel free to choose whatever's most interesting, and you can come back to them. So whenever you have time. So the three are, the first one is a Bollywood dancing made easy, and love the ladies that created that one for us and for that experience together. The second one is therapeutic yoga for cancer support. So if you would like to check that one out, please head to that room. And then the third one is demystifying nutrition, how to read beyond the labels. So we hope that these are some good end of the day sessions in some different areas than what we've covered so far. Deeply grateful for everybody who's been with us today. We look forward to tomorrow. It's going to be another incredible, incredible day tomorrow. Our virtual exhibit hall and the clinical trial fair and chat rooms all open at 9 a.m. Eastern. So please head there early at the start of the day. We also have the really special and important pre-conference session that I've mentioned before, which also starts at 9 a.m. Eastern. It's titled, Did Cancer Get Lost in COVID? And it is a session focused on how to get back to screenings, to appointments that we've missed, and to manage ongoing cancer in spite of the massive interruptions to life and health because of COVID. We have an advocate, global advocate, a physician, a hospital administrator on the panel who are going to bring incredible insight and understanding. And as Lorna says and Ben says, we need you and we need your voice to understand how this is affecting you. So this is a passion project of Mariah's. We hope that you will join us and be an active part in that session. That is all of my notes. I had to just breathe and make sure I didn't miss anything else. It has been humbling to see what day one of the Global Virtual Cancer Conference is. I can't wait to see what day two has in store for us. And I am forever grateful for all of the heroes who are here making this what it is. Thank you and see you tomorrow.